amiloride, potassium-sparing diuretic, amiodarone, potassium channel blocker, class 3 antiarrhythmic, amlodipine, dihydropyridine, calcium channel blocker, benztropine, Parkinson disease, cholinergic antagonist, bromocriptine, Parkinson disease, dopamine agonist, rarely used, buspirone, generalized anxiety disorder, partial 5-HT1A receptor agonist, bupropion, depression, smoking cessation, NEDA reuptake inhibitor, cimetidine, gastritis, peptic ulcer, H2 receptor antagonist, cetirizine, allergy, second generation antihistamine, chloramphenicol, antibiotic, blocks the 50S subunit, chlordiazepoxide, long-acting benzodiazepine, chlorpromazine, typical antipsychotic, chlorpropamide, first generation sulfonylurea, chlorpheniramine, first generation antihistamine, chlorthalidone, thiazide diuretic, clozapine, atypical antipsychotic, clomipramine, tricyclic antidepressant, clomiphene, infertility due to anovulation, selective estrogen receptor modulator in the hypothalamus, clonidine, hypertensive urgency, ADHD alpha-2 agonist, doxepin, tricyclic antidepressant, doxazocin, BPH, hypertension, alpha-2 antagonist, eplerenone, potassium-sparing diuretic, propafenone, sodium channel blocker, class 1C antiarrhythmic, fluoxetine, depression, selective serotonin reuptake inhibitor, flufenazine, typical antipsychotic, mifepristone, pregnancy termination, progesterone receptor antagonist, misoprostol, used with mifepristone for pregnancy termination, PGE2 synthetic analog, naloxone, opioid receptor antagonist, treats toxicity, naltrexone, opioid receptor antagonist, prevents relapse, nitroprusside, hypertensive emergency, increased cGMP, nitric oxide, nitroglycerin, anti-anginal, increased cGMP and nitric oxide, omeprazole, proton pump inhibitor, inhibits hydrogen potassium ATPase in the parietal cells, ketoconazole, antifungal, inhibits fungal sterol synthesis, aripiprazole, atypical antipsychotic, D2 partial agonist, anastrozole, ER-positive breast cancer in postmenopausal women, which is an aromatase inhibitor, rifaximin, hepatic encephalopathy, decreases ammoniogenic bacteria, rifampin, anti-tuberculosis drug, antimicrobial, inhibits DNA-dependent RNA polymerase, sertraline, depression, PTSD, selective serotonin reuptake inhibitor, seligalene, Parkinson disease, MAO-B inhibitor, trazodone, insomnia, blocks 5-HT2 alpha-1 adrenergic and H1 receptors, also weakly inhibits 5-HT T reuptake. Tramadol, chronic pain, it's a weak opioid agonist. Varenicline, smoking cessation, nicotinic acetylcholine receptor partial agonist. Venlafaxine, serotonin, norepinephrine reuptake inhibitor.